This is the first paper I'm going to look at in terms of diagnostic testing for long COVID. It's looking at original studies published before October 5th, 2022 for patients of all ages, sex, and ethnicity, looking at over 2,000 long COVID patients who are generally around 52, female, white, and non-vaccinated. In this review article, they're evaluating blood plasma biomarkers that are different between long COVID patients and a control population. The authors found that different biomarkers may indicate a preference between brain, lungs, and GI for what's hit worse by long COVID. For the brain, these are a list of biomarkers which could be an indication for a neurologic predominant long COVID, such as reemergent Epstein-Barr virus, presence of COVID antibodies, among others, where the level of COVID in different extracellular vesicles were assessed in the patient's blood plasma, and there was a high level of exosomes containing COVID proteins in these individuals. Additionally, high levels of interleukin-6, tumor necrosis factor alpha, and a monocyte chemoattractive protein were found in these patients, with elevated beta-glucan levels being associated with vision problems, neuropathy, and pain. For those with lung-predominant associated issues of long COVID, this is a large list of potential biomarkers that they looked at. The review found that exhausted and highly cytotoxic lymphocyte populations listed here were found in long COVID pulmonary patients with downregulated interleukin-2 and upregulated interferon gamma correlating with pulmonary long COVID. For GI predominant long COVID symptoms, these are the potential biomarkers. All of this again being found in the blood plasma. T cells with the cytotoxic markers listed here were reduced at the acute phase of infection, so during your COVID infection, this reduction being associated with the GI symptoms, while an increase in those markers suggests respiratory long COVID. Interestingly, also within the blood plasma existed large microclots that had increased levels of coagulation proteins, such as plasminogen, fibrinogen, and Willebrand factor proteins, which participate in endothelial injury and hypercoagulation. Also, higher levels of vascular endothelial growth factor was detected in the phase when you still have COVID, and COVID RNA-emia, which would indicate memory impairment and fatigue.